There was also one other question that was asked as well, and that is if there's a topic in pharmacology that you want to emphasize in class, what would the topic be? I would say learn everything you can in pharmacology because it's a very important aspect of healthcare. As a nurse and as someone that's constantly interacting with patients on a day-to-day basis, you're going to come to realize that pharmacology has a very important role in how we interact and respond to our patients and ultimately how we treat our patients. So my advice is that and the thing that I would focus a lot on is know your classifications of drugs, know how the drugs interact with other drugs, how they interact with the patients in terms of the different systems, understand the side effects of the medication, and drug interactions. But I would say ultimately you need to know everything you can about pharmacology. One slip up, one miscalculation, one decimal point somewhere could ultimately leave a patient in dire straits, could ultimately lead to a patient's death. We have seen many cases in recent years where kids were given the wrong dose. Ultimately, they were given the wrong amount of medication that ultimately led to their death. So my advice, and one area that I would definitely need to work on, and I would encourage anybody to work on, is really drug calculations and having an understanding of the different classification of drugs and how it impact the individual. It is very important that you really get a good understanding in terms of how these medications affect our patient. It is very crucial. Many nurses have lost their license because of bad, either not giving them the right medication, probably giving it to the wrong patient, or giving them the wrong amount of medications. So it's very important that you have and you gain as much knowledge as possible in better understanding how our drugs and the drugs that we give affects the patients that we take care of. I am encouraging you and encouraging everybody to work hard, study hard. This is a program that's attainable. I have always felt that if I can do this program, it can be done, surely done by anyone else. It's a doable program, and I'm looking forward to seeing you on the floor, whether it be in the ER, telemetry, med-surg, and making a difference in the lives of the people and the population that we serve. Thanks.